Hello, my name is Justin Riffle. I'm a rising fourth-year medical student at the University of Kansas School of Medicine. So patients who have undergone refractive corneal surgery, mainly LASIK and PRK, are of particular interest to glaucoma specialists because these surgeries are known to modify and thin the corneal stroma and therefore a lower central corneal thickness. This alteration of the cornea can then have effects on pressure measurements. Specifically, we know that thinner corneas could potentially cause an underestimation of intraocular pressure by traditional methods, and so therefore patients might be at risk for progression just based off of not being treated adequately. There have been multiple studies investigating the effects of refractive corneal surgery, and specifically how that relates to changes in intraocular pressure and looking for correction formulas in these instances. These studies for patients who have undergone the refractive corneal surgery are all suggesting that these patients are potentially at risk for progression. But there really isn't much literature specifically looking at the risk of glaucoma progression in patients who have undergone LASIK or PRK. So we wanted to know if patients who have undergone LASIK or PRK are at an increased risk of faster progression than their counterparts who have glaucoma but haven't undergone this surgery. Glaucoma progression can be difficult to study retrospectively, so the aim in our study was to compare the rates of retinal nerve fiber layer thinning in glaucoma patients who have had LASIK or PRK versus glaucoma patients who have not had the surgery. So we retrospectively identified patients who met our criteria. We then extracted all the data we had available on spectral domain OCT scans for all of our patients, performed linear regressions, and then calculated the means and medians of these rates of change over time between groups. So our two groups had very similar characteristics, and I want to point out several of those. As far as gender and race go, those were very similar between the two groups. And also importantly, the baseline age was not statistically different between the two groups, nor the years of follow-up, nor the baseline retinal nerve fiber layer thickness. So going back to age, that of course is important because if one group was older than the other, that could confound our results, as age could be a risk factor for progression. And then we're looking at that baseline retinal nerve fiber layer thickness. We might expect patients who started out lower or thinner to not change as much over time due to a floor effect where they've simply lost all of the nerve fiber layer that they had to lose, and then you would see less change over time. And so just jumping straight to the results, we didn't find any significant difference in the rates of retinal nerve fiber layer thinning between groups. And so we'll also point out that the central corneal thickness measurements in the LASIK group were significantly thinner than the non-LASIK group, and this was expected given the prior corneal surgery. And we also saw that the follow-up intraocular pressure measurements were lower in the LASIK group. This could be explained by, again, that lower or that thinner central corneal thickness, and it's artificially lowering that pressure reading, or this could be a result of the glaucoma specialist taking into account that history of the LASIK surgery, and then using the knowledge that this changes the corneal biomechanical properties, and knowing that that will affect pressure measurements, intentionally lowers treatment goals in order to counteract the potential for under-treating. So the fact that we didn't find a difference could have several implications. One could simply be that if there is a difference, the difference is too small for our study to detect. Another reason could be that the glaucoma specialists adequately treated their patients. They appropriately lowered intraocular pressure, they had appropriate treatment goals, and these patients were adequately treated. And so compared to their counterparts who did not have LASIK, they didn't progress any faster by our measurements. The notable connection to make to the literature is that while some studies have associated thinner corneas with faster glaucoma progression, we did not associate the thinner cornea in the refractive corneal surgery group with faster rates of thinning of the retinal nerve fiber layer. So the next step to build on these results would be to perform a much larger study of patients who have had refractive corneal surgery and those who have not with glaucoma, and then control for central corneal thickness and intraocular pressure. That way, when we're comparing progression rates or nerve fiber layer thinning rates between groups, their only difference would be simply the history of the corneal surgery. And of course, this study would further clarify the relationship of central corneal thickness itself on glaucoma progression and whether or not the actual surgical thinning of the cornea, like through LASIK, really does increase patients' risks for glaucoma progression.